So in this session, we'll be dealing with the tympanic membrane, otherwise called eardrum. It is oval in shape, semi-transparent, pearly gray trilaminar membrane. It forms the lateral wall of the middle ear with convexity towards tympanic cavity. The maximum point of convexity is called as umbo. Separates the middle ear from external acoustic meatus. Maximum diameter is 9 to 10 millimeter. Minimum diameter is 8 to 9 millimeter. So it is obliquely placed, makes an angle of 55 degrees with the floor of the external acoustic meatus. In the newborn, tympanic membrane is almost horizontal. That's why child can withstand noisy sound better than the adult. You can see this is the entire lateral wall. This part is the epitympanic part of the tympanic cavity. And here you can see this is the main component of the lateral wall of the middle ear, which is formed by the tympanic membrane. So here you can see this is the head of the malleus with the anterior process. You can see the body of the incus with the short process. You can see the supporting ligaments. And if you see with respect to the tympanic membrane, you can observe this is the handle of the malleus, and here you can see the long process of the incus. So this entire thing, if you see, this is the tougher part or the fibrous part, pars tensa, and this is the lax part of the tympanic membrane, pars flaccida. So let us see the further details. You can see the relationship of the chorda tympani nerve. So you can see this is the facial nerve in the posterior wall of the middle ear. You can see the chorda tympani nerve arising from the facial nerve, and here you can see it is passing medial to the handle of the malleus, and here you can see it is passing through the pituotympanic fissure. So this is what we are seeing from the inside view of the tympanic membrane. It is not the external view, it is the inside view of the tympanic membrane, that is within the middle ear cavity we are seeing the tympanic membrane and its relations. So circumference of the tympanic membrane is formed with a fibrocartilaginous ring which is attached to the tympanic sulcus, which is present at the bottom of the external acoustic meatus. Then if you observe, the sulcus is deficient above. You can see here the sulcus is deficient above. Here it is proper, but in the above part it is deficient. Tympanic sulcus is deficient. So there, from the tips of this sulcus, there extend anterior malleolar fold and posterior malleolar fold to the lateral process of the malleus. So from the two ends of the sulcus, anterior and posterior malleolar folds converge to the lateral process of the malleus in the upper part of the tympanic membrane. So this will divide this entire tympanic membrane into a small triangular part called pars flaccida, which sometimes presents a foramen, and the remaining lower part is the pars tensa, which is rendered taut by the handle of the malleus and the radiating fibers from the intermediate layer of the tympanic membrane. You can see when we see from the out surface by putting a light, we can observe a cone of light in the anterior-inferior quadrant. You can also see here the long process of incus behind the handle of the malleus. You can see this is the lateral process of the malleus. So lateral process of malleus, anterior and posterior malleolar folds will divide the entire tympanic membrane into the upper flaccid part, the pars flaccida, and the lower tense part, the pars tensa. So pars flaccida, small triangular lax area above the malleolar folds, sometimes presents perforation. Pars tensa, remaining part which is rendered taut by the handle of malleus and by deposition of radiating fibers of the intermediate layer from the handle of malleus. Pars flaccida and pars tensa, these are the subdivisions of the tympanic membrane. Surfaces. The lateral surface faces downwards, forwards and laterally. The medial surface is convex and bulges towards tympanic cavity. The maximum point of convexity is the umbo. So this surface receives attachment of the handle of malleus with backward inclination up to the center of the membrane. So if you see here, so there is a slight backward inclination up to the center of the tympanic membrane. The attachment is between the mucous membrane and the fibrous layer of the tympanic membrane. So medial to handle of malleus, chorda tympani nerve passes anteriorly. This also passes between mucous and fibrous layer of the tympanic membrane at the junction of pars flaccida and pars tensa. That means at this point here, it passes from anterior to posterior. Chorda tympani nerve, that is on the medial aspect, that is towards the middle ear cavity. You can see here is the handle of the malleus. You can see this is the mucous lining of the middle ear. So this is the lining, continuation of the mucous lining of middle ear as the mucous layer of the tympanic membrane. Here you can see the skin of the external acoustic meatus continuing as the cuticular layer of the tympanic membrane, and you can see here the fibrocartilaginous part of the tympanic membrane. So this is the fibrous layer. You You can see the fibrocartilaginous rim attached to the tympanic sulcus. So there are three layers of the tympanic membrane: outer cuticular layer, middle or intermediate fibrous layer, and inner mucous layer. So it is between the mucous layer and fibrous layer there is handle of malleus and the chorda tympani nerve. Outer cuticular layer lined by keratinized stratified squamous epithelium, which is continuous with the skin of the external acoustic meatus. Intermediate fibrous layer, it has outer radiating fibers and inner circular fibers. In pars flaccida, this is replaced by loose connective tissue. Inner mucous layer lined by simple columnar or squamous epithelium with patches of cilia in the upper part of the membrane. Three layers: outer cuticular, inner intermediate fibrous, and inner mucous layers. So there are three recesses: anterior recess between handle of malleus and anterior malleolar fold, contains chorda tympani nerve. Posterior recess between between the posterior malleolar fold and the handle of the malleus, again chorda tympani nerve. Prusac space, which is a mucous recess above the lateral process of malleus between neck of malleus and the pars flaccida of the tympanic membrane. I can show you here. So this is the Prusac pouch between the neck and the pars flaccida of the between the neck of the malleus and the pars flaccida above the lateral process. Prusac pouch or Prusac space. So you can see schematic diagram showing four quadrants: anterior inferior quadrant, anterior superior quadrant, then posterior superior quadrant, and posterior inferior quadrant. Why these quadrants are important? Because there are certain deep relations, okay, which are very important here. I'll show you what are the deep relations. So anterior inferior quadrant, it is related to the carotid canal deeply. Anterior superior quadrant, it is related to the tympanic opening of the arterial tube. Posterior superior quadrant is related to long process of incus, stapes, and fenestra vestibuli, and posterior inferior quadrant is related to promontory and fenestra cochleae. So that's why if you prefer myringotomy, that is opening of the tympanic membrane, we will be preferring posterior inferior quadrant. So let us go back. So you can see here, this is the long process of the incus. You can see the handle of malleus. You can see the cone of light. So when we examine through the external acoustic meters the tympanic membrane, we will be observing a cone of light. I'll show you the real picture. So pars flaccida is also called as the Sharpnell's membrane. You can see the anterior malleolar fold and posterior malleolar fold. This is the lateral view from the outside. Anterior and posterior malleolar folds, pars flaccida, handle of malleus, incus, long process, cone of light. So if you see from inside, you can see directly the handle of malleus. You can see the chorda tympani now extending from posterior to anterior, medial to the handle of malleus. So arteries, deep auricular branch of the maxillary artery. This ramifies beneath cuticular layer, that is the outer layer. If you see on the mucous layer, stylomastoid branch of the posterior auricular artery and antetympanic branch of the maxillary arteries will supply the mucous membrane. Veins, outer layer into the external alveolar vein, inner layer into transverse sinus and pterygoid venous plexus. Nerves, auricular temporal nerve, upper and anterior part, auricular branch of the vagus, lower and posterior part, same like external acoustic meatus. Then glossopharyngeal nerve through the tympanic plexus supplies the inner mucous layer. So examination from outside, there will be a cone of light in the anterior inferior quadrant, and there will be handle of malleus and long process of incus. And you can also see the lateral process of malleus. We can see here. So this is the cone of light in the anterior inferior quadrant. This is the handle of the malleus. This will be the lateral process of the malleus, and here this will be the long process of the incus. So from the interior view, you can see this is the handle of the malleus. This will be the long process of the incus. You can see the chorda tympani now. This is the chorda tympani nerve within the recess of the tympanic membrane. So you can see here the tympanic membrane connected through the malleus, incus, and stapes to the internal ear through the fenestra vestibuli. So when this vibrates, all these ossicles will vibrate, and through the fenestra vestibuli, it will create vibrations in the perilymph of the inner ear. So again, the same relations: anterior inferior quadrant related to the carotid canal, anterior superior quadrant related to tympanic opening of the arterial tube. These are the two structures which are in the anterior wall of the middle ear. So posterior superior quadrant, long process of incus, stapes, and fenestra vestibuli. See, there are so many ossicles related to the posterior superior quadrant. So safest will be the posterior inferior quadrant, promontory and fenestra cochlea. These are the relations of the medial wall. So when we open the tympanic membrane in posterior inferior quadrant, the chances of reaching to this point is very less. and we will avoid all these important structures when we prefer the posterior inferior quadrant. So myringotomy, preferred site is posterior inferior part of the tympanic membrane to avoid injury to the chordae tympani nerve and ear ossicles. Then perforation of tympanic membrane, it might be traumatic due to exposure to loud sound, sudden loud exposure or trauma. And then secondary to otitis media, where pus is collected within the middle ear and there will be rupture and oozing of the pus through the external acoustic meatus. Myringoplasty is the closure of the perforated tympanic membrane. Either we can use a artificial mesh or we can use a temporal fascia for closing the tympanic membrane. Thank you.